Hi guys, as it's September and I know a lot of you will be starting university and your nursing courses in the next few weeks, I wanted to do a video about 10 pieces of advice that I would give you as a student nurse just about to start your degree. Number one is ask lots of questions. Just ask questions all of the time. Ask questions after your lectures, ask questions in your lectures, in your seminars, ask your peers, ask other students, ask people on placement, ask practice educators, ask all your questions, because it's such a short time that you're a student nurse and you're in university and you're studying, and you kind of get away a bit more with not knowing stuff, and it's the best time for you to learn and just absorb all that knowledge and all the information that you possibly can. Secondly, and kind of to do with that, is to keep a notebook with you all the time in placement and at university, because sometimes those questions come into your mind and then you kind of forget what you wanted to ask, and it's best just to keep a notebook so that if when those questions come into your mind, or those comments or things that you want to go home and research come into your mind, you can jot those down. So if you, for example, in placement come across an illness or a medicine that you don't know much about, you can write the name of that medicine down, the name of that illness, the name of a particular type of treatment that you want to research, that you can go home and look at your book and know what you want to research, because you will forget it. There's so much to learn and so much to absorb. It's important to try and remember everything that is going on. The same as when you're in lectures, your lecturer might say a word or a phrase that you don't understand. They might talk about a subject and you don't really quite understand everything they're saying about that subject. Write it down and either ask them afterwards or go home and do your own research. And the third bit of advice is to let embarrassment go. There's just no point being embarrassed, because I know that I was embarrassed doing OSCEs and things like that, and you're literally doing patient care to a plastic dummy, and it is embarrassing and it feels weird, but you will look the best and you'll have less need to be embarrassed if you just act like they're a person and just pretend almost that you're not embarrassed, and just put on this kind of confidence and go out there and just smash it. Just do what you need to do without being really shy and really embarrassed, because that kind of just gives the wrong impression. The same in placement, and again, it's kind of about asking those questions and seeking those answers, and not being embarrassed to ask questions in lectures, ask questions to your mentors, not being embarrassed to kind of put yourself forward to do certain tasks, to ask, oh, actually, can I do that? Or do you mind if I listen to the chest sounds and kind of see if I can hear what they are, because if you're embarrassed, you'll get less opportunities to learn. If you want to do something, ask it. It's the best opportunity you have while you're a student, and you'll never get that opportunity again, so just let embarrassment go. Fourthly, you want to be ready to listen and be confident but not cocky. Placements and lecturers really don't like cocky students, because you're going into placement, to lectures, to learn as much as you can, and they're the experienced nurses, they're the experts, and you might have come from a place with lots of experience in a particular field, and you might have come from a place with family experience of a particular condition, and you might know that you are right, and you might know that you have the most up-to-date knowledge from university, from lectures, from reading, and evidence-based practice. But don't go in with that kind of cocky attitude of I know everything, because you really don't, especially in your first year. And I've seen students underconfident and not kind of putting themselves forward to do stuff. So confidence is important, but you also don't want to go in kind of being really cocky and feeling like you know things, and why am I doing OBS over and over again? I can do this, and why can't I do this procedure and that procedure that you might get to do in your second or third year, because in the first year is a lot about doing OBS, but it's so important to be able take obs accurately. And it's not just about physically being able to do a blood pressure and read it accurately. It's about being able to understand what a normal blood pressure is, why blood pressures are abnormal, what a high blood pressure could mean, what a low blood pressure could mean, what certain conditions and medications affect how a blood pressure what a blood pressure reading is. And that's something you learn from doing it again and again and again. So just go in being really ready to listen to qualified nurses, to listen to more senior students, listen to your lecturers, and learn as much as you can. Number 5, before you even start university and all through your first year, practice drug calculations. This is what I did actually before I started university. I got a little book from a qualified nurse who was a friend on all about drug calculations and kind of the maths. The initial chapters were the maths that you had to do before being able to do drug calculations, and the next couple of chapters were all about drug calculations and all the things you need to know. And I went into university knowing already how to do drug calculations, so when it came to learning that and doing the maths and doing those lectures and doing it as a student nurse in placement, it was quite easy for me because I'd already practiced it. And I think it's just a really good skill to have. It's very easy just to do sort of 10-15 minutes here of just practicing those math skills, practicing those drug calculations and kind of getting it right and understanding the theory of it, understanding how to do it, so that it's just one less thing that you need to worry about when you're in your first year, and you can focus more of your time on learning other things. There are loads and loads of online resources for that. You can just type in nursing medication calculation examples or tests, and lots of universities have put theirs on there. Just to add on there, this is my first video in September, and it's obviously 10 pieces of advice for student nurses, but I'm going to do a video on some basic math skills that you need to know going into university, so stay tuned for that. Number 6, do not get behind with your work, with your placement hours, as much as you can, as much as possible. Obviously with placement, if you're sick, you're sick, but try and make it up as soon as you possibly can, because you don't want that to delay things going into the next year. You don't want to have to work loads during your summer holidays. And with your coursework as well, you don't want to take lots of your coursework and essays into your placement. You want to try and get the majority of it done before you go into placement. And when you get behind, that's when you get really stressed. That's when it's really hard work. So as soon as you get the work, you set times in your timetable where you do a particular essay, where you revise a particular subject, and you just be really meticulous about it, and you get a time that works best for you. So for me, at the time I was at university, I lived with my parents, so my mum and my dad and my sister were all at home, and I found it really hard to revise or do much in the day. So I would get up before my whole household got up at like 5:30 or 6 o'clock in the morning, and I would do all my work and revision. Then I'd listen to my lectures, and then I would have a big break between sort of 8 and 9:30ish, because they would then be getting up, getting their breakfast, getting ready for work, going to work, and I just couldn't work in that environment. And then I would then go back to it after they'd gone to work and did sort of the next part of my study day. So it's really important, even if you don't have a huge amount of work to do in the first few weeks, create your own work. You know, go and look up things that might be mentioned. You'll probably get a reading list. Go and look up those books, use the library, ask your lecturers, ask your students, ask qualified nurses that you might know, what should I be reading, what should I be researching, what should I look at. Subscribe to a nursing magazine and read through that. If you don't understand stuff, research stuff. Just work as hard as you can and as regularly as you can, so it's not this big build up at the end of term or when you have a deadline, if you possibly can. And kind of number 7 is kind of linked with that as well. Try to read as much as you possibly can. Read about pathophysiology, read about anatomy, read about all these different illnesses that you come across, read about as many medications as you can, read about observations, read about clinical practice, read about current nursing issues, read the RCN, read the stuff that NMC puts out, study and read and absorb as much as you possibly can, because this is just the time to do it. It's the time to absorb all the knowledge. When you're a student, when you're qualified, it's much harder to do that in terms of time because you're working full time, but also in terms of you're qualified and you're expected then to know stuff. Obviously you're not expected to know everything. You can still study. Nursing is a career you study your entire life. You never get to the end of your study and you just always constantly reading, but it's a really good opportunity to do that as a student nurse, and a really good habit to get into for the rest of your career. Number 8 is kind of also linked to what I was saying about when I work with my family, is to know your learning style. So for me, I am rubbish at learning anything past 3 o'clock in the afternoon. I'm not a person who can kind of go to bed and revise until 11 p.m. My brain does not work at that time. My brain works much better at 5 a.m. than it does at 5 p.m. And I know that about myself. So when I study at 5 a.m. I'm also borderline dyslexic, so I have to learn in a very repetitive way. I have to read, reread, read again, write it down, highlight it, go through my notes again, you know, do it in a different way, use coloured highlighters, order things in a particular way. And I kind of learnt that when I was in sixth form. Actually, I kind of learnt my learning style, but even at university I was learning new things all the time about how I work and how I best learn and how I retain knowledge. To give you an example of that, in my exams, I'm really terrible at exams, and I did a BTEC, so I didn't do exams before going into university. And my first year exams I did okay on, but my second year exams I didn't do very well on. And it wasn't until my third year that I realised that I needed a really repetitive technique. So I actually did the exam at home. I made my own mock exam, because you kind of know what they're going to ask you. You know, broad idea that they're kind of going to ask you about evidence-based care and nursing practice and nursing care and pharmacology and anatomy and physiology and things like that. So I set up my own mock nursing exam, gave myself the amount of hours that I would have in the exam, put away my notes, put my time on, and wrote the exam. And I did that about 3 times. So I spent about 6 hours doing these mock exam papers that I wrote myself. And then I would go through the exam and I'd go through my notes and see what I'd missed. And if I missed, I'd be like, right, I have to remember that. And I'd do it again, and I'd do it again, and I'd do it again, until like the 3rd time, everything that was in my notes was in my exam. So then when I came to write the exam, it was all in my head. I just wrote exactly, like almost verbatim, what I knew, and I had to work like that. For you might be able to read something once and it's just in your mind, and that's fine. But knowing your learning style will really help you in just retaining that information, knowing what works best for you. Same with study groups. Some people will advise you to be in a study group. I think that's really good socially. It works really well for some people. It's really good for social learning, because you'll focus on something and someone else will focus differently and you learn from each other. But I found it really difficult to learn in those circumstances, because I needed absolute silence. I needed to speak aloud to myself as I read. I needed to be able to jot things out, and so I very rarely used the library to do my revision. I used it to obviously get my books and resources, but I would take that home, lay everything out on my dining room table, walk around, I'm a very verbal, physical learner, and that's what I would need to learn. But so you know what your learning style is, and it would really help you out. Number 9 is to smile. And I say this because I kind of learnt it through university. It sounds like a kind of weird piece of advice, but when you're smiling to people, you come across as friendly, and you come across as, you know, people struggle then to dislike you or not get along with you. And I think I first learnt it in terms of dealing with aggressive and difficult patients and parents. Because I found that if I went in smiling, saying, oh, good morning, my name's Natasha, I'm going to be your nurse today, how are you, how was your night, and I'm just overly friendly and kind and smiley, it diffuses all tension, and they find it really difficult to then be aggressive and frustrated and angry at you. And then I kind of just adopted that in everything I did. I would do that with my colleagues, I would do that with my peers, I would do that at university. And I kind of wanted to add it in there because I found it a really helpful way of just getting on with everyone, and being friendly, because nursing is a tense environment and it just kind of diffuses all that. So weird bit of advice, but I found it helpful. And finally, number 10 is to find support, your support system, whatever that might be. That might be your university lecturers, it might be your mentors, it might be your peers and fellow student nurses, it might be your husband, it might be your siblings, your best friend, whoever it is. It's really important to have someone there to support you, even in very simple things. For example, I lived with my parents, as I said, when I was at university, and even being able to come home on a shift at 8:30 at night and have my dinner cooked for me. Like, if you have a friend who can cook you dinner or a mum or a husband, and have that, it makes life so much easier. Sometimes my husband, more when I was qualified, well, we got married after I was a student, but when I was qualified, sometimes my husband would pack my lunch for me in the morning while I got ready, because it's such a long nursing day, particularly in placement. It's just really difficult. And then also someone to talk through your day with you when you come off a shift or when you come out of university. Someone who understands that you need time and space to do your work, to revise, to process what you've done. Someone who might even understand that actually when you get home from work you just need quiet because you've been talking and pouring yourself out all day and you just need to switch off. Whatever it is that you need, you find that in someone who will support you in the ways that you need. The way I need support will be different to the way you need support, will be different to the way your friend needs support. But it's important to be able to have open communication with your support system and being able to tell them what you need at any given time, whether you need silence, whether you need to talk things through. Because sometimes as well, placement, we can see some really difficult stuff. And really, especially if you're going to university, I think, when you're 19, 20, and the things that you're seeing at 19, 20 aren't what most 19, 20-year-olds will ever see in their entire life. And it can be traumatic and it can be really hard. So it's really important to find that support. Yeah, I think that's all I had to say. This video is much longer than I planned it to be, but I really hope that was helpful. And I will do a video about the nursing maths and probably a few more videos related to being a student nurse. Oh yeah, the other one was what you need for placement. So I'll at least do those 3 videos and maybe another one for you as well in September to get you guys ready for going to university. Good luck, have fun, enjoy it, and I'll see you guys in my next video. Bye.